Well, June is National Men's Health Month, and men are often at risk for certain mental health concerns over other people.
Our Alyssa Heron spoke with a psychologist at Spectrum Health to discuss tips on how to get help in this week's medical moment.
You gotta man up. You gotta, show no weakness, be self-reliant, these kinds of things. Men who tend to, for whatever reason, really tend to conform to these norms end up also tending to have a higher risk for mental health problems.
Michael Flynn, a clinical health psychologist at Spectrum Health, says these ideas that are communicated to men in our culture can have a long-term impact, but therapy can help.
One way of thinking about going forward for yourself, if you start to notice, I don't know, like maybe I could use some help. Maybe I don't want to feel this depressed or anxious. One way to go forward is to think of it as like starting a conversation with your doctor. It's not like you don't need to go tomorrow. You don't need to go the next month. Just starting that conversation, even like a primary care physician or any other kind of professional you may have contact with, a loved one you trust or mentor or someone in church or whatever it is. It does take courage sometimes to kind of go against the norm in a way that you've experienced or that you've learned. It's not lost on me, when men come in and what they've gone through to get there emotionally. I really respect that.
And Dr. Finn says research shows therapy and medication tend to be the most effective treatment, but that can be decided later on.
That first meeting often is a chance to kind of go through what's going on in your life, really kind of get it all on the table, so to speak, and then come up with what would be the best solution. Because it does get complicated, and it depends on diagnoses, it depends on all kinds of things.
And if you have a male in your life you'd like to have a conversation with about getting help, it's important you be ready for the talk yourself.
I encourage kind of checking your own distress, checking your own discomfort, and kind of when you go to approach them, being open to kind of holding that discomfort in that moment, to giving that space to that person, to really ask a genuine question like, how are you? Often, in our culture, men don't get asked that question in that really genuine way. And being willing to hear the answer, and be there for them, that's a tough process.
In Grand Rapids, Alyssa Heron, Fox 17 News.
When it comes to finding the right person for you, Dr. Finn says it's important to remember that you're building a relationship in a safe space. But if you don't feel like you can trust them or share openly, let them know so they can find another fit for you. For more resources on mental health and therapy, just look for this